Welcome to today's Explainer. Today, we're diving into some absolutely fascinating insights from Dr. Cato, a physician with over 20 years of experience, all about a hidden danger lurking inside, well, pretty much all of us. We're going to reframe how we look at the liver. It's not just an organ, it's this incredibly complex, literal chemical factory. And as you'll see, we're going to learn exactly how to read the subtle warning signs when that factory starts to break down. Now, to really grasp what's going on, you first have to understand this famous paradox surrounding it. In the medical world, the liver is known as the silent organ. Unlike your stomach or your muscles, your liver will actually endure a massive amount of damage without ever sending a single pain signal to your brain. Crazy, right? It just quietly takes a beating day in and day out. Because of this, by the time the liver finally speaks up and you actually feel symptoms, well, the house is often already on fire. That's why so many people only discover they have liver cancer when it's advanced to a terrifying late stage. So the crucial point is that we absolutely do not want to wait for cancer to form to start paying attention, right? Our big goal today is to spot the biological failures of a condition called cirrhosis, which is the direct precursor to liver cancer. If we can spot the signs of cirrhosis, which is basically when the liver hardens up and loses its function, we can actually catch the damage before it creates that perfect environment for tumors to grow. Here is our roadmap for today. We'll start with the cirrhosis loop, then move on to toxic buildup symptoms, fluid and protein loss, dangerous blood pressure issues, and finally wrap up with the modern liver threats. We're framing this whole thing around how the liver acts like a factory that breaks down in very specific, highly predictable ways. Okay, jumping into part one, the cirrhosis loop, and exactly how the liver hardens over time. Think about what happens when you cut your skin. It bleeds, it scabs over, and eventually it forms a hard scar. Well, your liver actually does the exact same thing when it gets damaged. But the real problem is this mechanical loop. The liver gets injured, fibrous tissue rushes in to patch up the wound, and that specific area becomes hard. When this happens repeatedly over and over across the entire organ, the liver becomes incredibly stiff. It gets entirely covered in this fibrous tissue and completely loses its ability to function. That hardened state, that's cirrhosis. And it is from this exact hardened tissue that cancer most frequently emerges. Let's move to part two. Toxic buildup symptoms. This is what happens when the factory can't take out the trash anymore. Now, what's really interesting about this breakdown is how specific escaping toxins map to some truly wild physical symptoms. These are our first four major warning signs. First off, if the liver can't excrete bile, it backs up directly into your blood. That causes jaundice, that yellowing of the skin, and just unbearable full-body itching. Second, a loss of detox function means things like alcohol, medications, and everyday metabolic chemicals just kind of linger in your blood. This causes severe fatigue and a total loss of appetite. It's basically like having a permanent hangover. Third, and honestly, this one is wild, your liver normally clears ammonia from digested proteins. When it fails, that ammonia builds up, crosses the blood-brain barrier, and literally causes consciousness issues or this bizarre flapping tremor in the hands. And fourth, the liver usually breaks down estrogen, which, yes, even men have. If it fails at that, estrogen builds up, leading to breast tissue development in men and distinctly bright red palms. Up next, part three, fluid and protein loss. This is where the liver's manufacturing fails. To really get this, think about making pickles, okay? Stick with me here. If you put salt on vegetables, water gets drawn out. But if you put salt-heavy vegetables into fresh water, water rushes back in. It's basic osmosis. Well, in your bloodstream, the liver manufactures a vital protein called albumin, and albumin acts exactly like that salt. It maintains the concentration in your blood, acting like a magnet to make sure water stays securely inside your blood vessels where it actually belongs. And that leads us to our fifth warning sign. When the hardened, broken liver stops manufacturing that albumin, the protein concentration in your blood plummets. Because of that, water literally leaks out of your blood vessels and just seeps into the surrounding tissues all over your body. This causes severe edema, meaning the legs swell up so much that just pressing a finger into the skin leaves a deep indentation. It also causes ascites, which is this massive, uncomfortable fluid buildup and bloating right in the belly. It can even cause pleural effusion, where fluid leaks into the chest cavity and physically crushes the lungs, making it incredibly hard to just catch a breath. Moving on to part four, dangerous blood pressure issues. We are talking about catastrophic plumbing problems here. This brings us to a pretty striking medical term, portal hypertension. You see, all the blood absorbing nutrients from your gut is supposed to flow smoothly, straight through the liver. But if the liver is all hardened and scarred up by cirrhosis, the blood hits a massive wall. The pressure builds up immensely. It's literally like a massive traffic jam on a major highway. And just like impatient drivers stuck in gridlock, this high-pressure blood is forced to find dangerous, tiny little detours just to make its way back to the heart. This traffic jam creates our sixth warning sign. When the blood takes a detour through the spleen, it actually causes the spleen to gorge with blood and become dangerously overactive. It gets so overactive, it starts destroying your own red and white blood cells and platelets. This leaves you anemic, short of breath, and extremely prone to dangerous internal bleeding. Alternatively, the blood might take a detour through the tiny, delicate veins in your esophagus or rectum. Now, these veins are definitely not built for that kind of pressure, so they swell up into fragile varices. If they pop, you're looking at vomiting blood or severe hemorrhoids. And that leads to the seventh, and definitely the most bizarre, warning sign. Sometimes, this massive blood traffic jam forces blood to detour right up to the surface of your stomach. It uses your abdominal veins as an emergency highway, swelling them up until they are thick, blue, and completely visible right under the skin. Medical professionals literally call this caput medusa, because those swollen veins radiating out from the belly button look exactly like the terrifying snake hair of the mythological Gorgon Medusa. No way you'd miss that. Let's move to and see how this builds in Part 5, the modern liver threats. So there is a massive twist in modern medicine regarding these threats. If you had asked doctors a few decades ago, the main culprits driving people into cirrhosis and liver cancer were hepatitis B and C infections. But thanks to some absolutely incredible medical advancements, viral hepatitis is steadily declining. However, the other side of the story is alarming. Cirrhosis caused by fatty liver disease, driven by modern diets, obesity, and overnutrition, is literally exploding off the charts. It is, without a doubt, the new dominant threat. And this is exactly where we have to completely reframe how we view a routine health checkup. So often, doctors tell patients they have a fatty liver, and patients just brush it off as a polite way of saying, they need to lose a few pounds. But actually, a fatty liver diagnosis is a severe, ticking biological clock. It's the absolute starting line for that cirrhosis loop we talked about. It is not a casual observation. It is your factory giving you one final chance to change operations before that permanent hardening actually begins. Which leaves us with this final, incredibly vital question. Will you listen to your silent organ before it's too late? The liver doesn't have pain receptors, sure, but it sends out plenty of other signals, from fatigue and swelling to red palms and those strange swollen veins. If you have an irregular health checkup or if you've been told you have a fatty liver, please don't wait for the house to catch on fire. Rethink your lifestyle habits, take action immediately, and protect your body's most incredible chemical factory.